the first story I think Jeff is really going to want to ask me questions about afterwards. But when I read the story, I thought this is not super surprising to me. A study that just came out from the Journal of Oral Rehabilitation found that the use of mindfulness, which is using a lot of psychotherapy and kind of going through meditation, helps with TMD related pain. Now, what they found was they put these individuals through a series of different uh, behavior activities and deep dives. They did the meditations and the sessions for like 1 hour a couple times a week, and then an initial 4 hour deep dive session. And they found that those patients from the beginning of the treatment compared to the end of treatment over a 6 week period or so had significant reductions in pain point locations, in overall discomfort, in functional use, and other statistical data points that they were tracking compared to the placebo group, to come out to say that they found benefit with meditation. But I think the overarching like piece of information is I think this is probably true for most pain disorders and for most pain patients. There's a lot of uh, common characteristics between patients that suffer chronic pain issues, autoimmune disease, psychoanalysis, psychotherapy issues going on, anxiety, other chronic ailments and illnesses, a lot of stress in their life. And so it probably is just highlighting the fact that there's a lot of benefit for mental support for those patients that are suffering from chronic disease. We'll get some intel from Jeff after we close the news session, because I'd love to hear it, especially if the pain is more nerve derivative pain as opposed to maybe anatomical pain or occlusion pain, which would certainly require other types of modalities. But the fact is, they still found an overall reduction in pain perception and pain pinpoint interactions in those areas after going through this meditative process. So it's nice to see alternative therapies that we might be able to provide to patients. Another update coming out of the ADA, a lot of contention coming into this House of Delegates. So we'll definitely be keeping you posted on the updates. We did see where there's, again, additional changes in the hired help of the ADA and a pretty significant $20 million cut in the budget moving into fiscal year 2026 because of endowment issues and revenue generating issues as well. With that being said, they're still trying to do the work of the ADA and to represent dentists and the issues that are currently impacting them. And with that in mind, they are seeking ambassadors to help address workforce shortages. Those letters of interest, if that's an area of interest for you, are due by the end of August 27th to be specific. These would be individuals that want to serve on different task force, be consultants, provide feedback, or just complete surveys, etc., to help the ADA understand the current workforce issues that may be going on for all types of practitioners, whether you're in public health, private sector, a PPO practice, DSO, the Indian Health Reservation, whatever it happens to be that you're participating in. I think they're trying to understand what the current challenges are for each of those sectors, and obviously how that also correlates to hygiene, assistance, FDAs, expanded function, DHATs, all of these different tiers and levels of personnel that we currently have in our practices. So again, if you are interested in that, there's a process that you can find on the ADA's website, but they are looking for help for their workforce issues. That is due, a letter of intent is due by August 27th. Another really interesting story that came out of the King's College of London. I feel like I've reported on them before. I think they're doing some really odd, interesting research. They're maybe pushing some boundaries that we're not seeing at all of the other institutes. They've discovered or are hypothesizing now that keratin, which is found in human hair, nails, and wool, may also be valuable in protecting and repairing enamel. So they're using, in the study, they're using hair and skin to try to repair teeth to see if they can get reparative benefit. So the hope is that there will be toothpaste and gels and other things that might be available to the public in the next few years. We don't have any products available currently, But who knows? We may be having some keratin paste on the market in the not too distant future. The last piece of information I wanted to share with you tonight was that Dr. Bicuspid, which is one of the many news sources that I follow on a regular basis, just completed a survey and published their results on August 19th, which was yesterday. They were asking for some additional information from their readers about their feelings of the economy and how it's currently impacting their practice. And I'm sure you're not surprised, but as we're heading into the fourth quarter of 2025, they are finding that dentists' stress level and their concerns about economic uh, challenges and the fruitfulness of their practices moving into Q4 and into 2026 is continuing to be one of the top number one issues that they're currently facing. In fact, it was 4 or 5 for most users. So, 65% of respondents rated their worry about rising operational costs at least a 4 or 5 out of 5. So it's definitely on top of mind for them and trying to manage all the different areas of increases in operational expenses, including staffing, rent, uh, consumable goods, dental lab fees, and honestly, just the continual cost of onboarding different technology and software and improvements and sort of managing your team and trying to get your practices operating at a high level of efficiency. It's becoming quite a compression on the profitability of the practice. So, just validating if that's how you feel tonight when you sit down in your lounge chair and grab your bourbon and sort of prop your feet up for the first time and sort of reflect on today and the things that are stressing you out. You're not alone. It would seem like most of our colleagues are also sitting in the same lounge chair. And with that, that's the news.